Hello everyone. So let's talk about the CHA2DS2 score. So CHA2DS2 score is used for risk stratification of ischemic stroke and thromboembolism, systemic thromboembolism in patients with non-valvular atrial fibrillation in order to estimate the need for therapeutic anticoagulation. This score is basically only used for non-valvular atrial fibrillation, because in valvular atrial fibrillation the stroke risk is so much high that the CHA2DS2 score often underestimates the risk for stroke. So anticoagulation is started despite the CHA2DS2 score. So there are 8 components inside the CHA2DS2 score. It includes CCF, congestive cardiac failure, which is 1 point, hypertension 1 point, age more than 75 years is given 2 points because age is a significant risk factor for the development of stroke. Diabetes mellitus is given 1 point. History of stroke or TIA or thromboembolism in the past is given 2 points. History of vascular disease, including previous MI or peripheral arterial disease or aortic plaque, it's given 1 point. And ages between 65 to 74 is given 1 point. And female sex is considered as an independent risk factor for the development of stroke in atrial fibrillation because especially when there are additional risk factors like age more than 65, then female is also considered as an independent risk factor for the development of stroke in atrial fibrillation. So the maximum score is 9 points. And according to the score, CHA2DS2 score, we have the increasing risk of the development of ischemic stroke or systemic embolism. So if the score is 0, then there is only 0.2% risk of development of ischemic stroke and 0.3% risk of development of systemic embolism or TIA. Whereas as the score increases, the risk of the stroke also increases. So this let's come to this one. According to the score, so if the score is 0 in case of male and 1 in case of female, that is considered as a low risk for the development of stroke or thromboembolism. So no anticoagulation is recommended for score 0 or 1 in case of female. If the score is 1 in male and 2 for female, then that is considered as the moderate risk. And in cases of moderate risk, we prescribe anticoagulation therapy based on the individual risk factors. So we need to consider anticoagulation in moderate risk. And if the score is more than 2, so from 2 to 9, then that is considered as high risk, and anticoagulation is recommended in such cases. Before starting anticoagulation, there is something called as the Has-Bled score. Has-Bled score. So Has-Bled score is a score which is used to estimate the risk of bleeding in the patients with atrial fibrillation before starting the anticoagulation therapy or during the continuation of the anticoagulation therapy for long term. So that is about the CHA2DS2 score.